Francoise. How are you today?
Hi, Julie. I'm good. How are you doing?
I'm fine. I'm fine. So, today is Stress Awareness Day. Why is it important that we talk about this?
Well, I just think it's a real chance to take stock on how we're feeling. What are our levels of stress? What is our well-being like? I think often with our busy lives, we don't often take that time just to stop and pause and reflect on how we're doing, or doing that with colleagues or people that we manage as well.
Totally agree. I know one of the things that I've picked up, in my role as head of diversity and inclusion at Acas, and especially looking at, we know the last 18 months has been really stressful for a lot of people. But we also know that for some people it's been more stressful. We know that particular groups, for example, people with disabilities, people from Black, Asian, or ethnic minority backgrounds, or people working in particular sectors have had what we would call a bad COVID. And again, there's that knock-on effect to stress. So is there anything more you can tell us about that? Why do you think that's happened?
Yeah, I mean, I think you're absolutely right. Different groups have been affected in different ways. I think what we probably can say is that for many of us, it's been the biggest test to our resilience this kind of recent time. But that there's been people that have been made redundant, people under enormous financial strain. People that have been working on the front line throughout the whole of the pandemic that are nearing burnout really, or already there, unfortunately. People that are juggling work with caring responsibilities. So an enormous amount of stress that has been prolonged as well that we've had to deal with. And I think, a little bit of stress is good because it keeps us kind of challenged and a little bit of that kind of pressure, if you like, and it keeps us motivated. But when it becomes too much, that's when it can become a problem, and it can lead to burnout and it can lead to mental health conditions.
So I've noticed you've talked about burnout a couple of times during that. What is burnout?
Well, burnout is where you get to a point where you are completely exhausted. So that might be mentally or physically or emotionally exhausted. So at work, it would be to a point where you can't perform very well. So your performance is going down. You're perhaps feeling very negative about your work, and just really not interacting with people and just feeling that, as I say, that complete exhaustion.
Yeah, I hear that. So what can people do if they feel they're coming up to burnout or if they're going through burnout? What are the tips you can give people?
So I think the important thing to think about, Julie, is that burnout isn't something that happens overnight. So it can happen in stages. So it might start off with people kind of feeling constantly under pressure, feeling like they feel a bit out of control. Um, but then what it can progress to is that people are kind of feeling like they can't switch off. So perhaps they're always on their email, always on their phone. And you can start to get physical symptoms. So feeling that nausea in the kind of pit of your stomach. And as it progressed, feeling very irritable, the physical symptoms can get worse. So people can have headaches that increase in severity. And, you could get more and more headaches, feeling really to a point where it gets to extreme burnout, where people feel exhausted, they feel empty, they feel unable to cope or interact with other people. And that's where you know that it really has got to a point where, as an individual, it's hard to do something about. But what we would be saying is if you reach that point, that you should go and get medical advice. So probably go to your GP.
Yeah. So that sounds quite serious, really. So what can employers or managers do to help prevent their people in their teams experiencing burnout?
So, as an employer, you do have a legal duty to assess the risk of work-related stress in the workplace and then to put things in place to mitigate those risks. So that's the first thing, really. As a manager, it's really about being proactive and regularly checking in with your staff and seeing how they're doing. And sometimes, that's you ask how somebody is, you might have to ask more than once, how are you really doing? And it's also important to really listen to your staff member. What are they experiencing? What is causing them stress? How can you work together to support that person? Are there any adjustments you can put in place if somebody is really struggling with their workload or particular pieces of work?
they're great tips, and yes, I really get the, workplace adjustments. We talk about that a lot in D&I as well. So
Yeah.
so great tips for what managers and what employers can do. But what about, we have a responsibility ourselves, don't we, to make sure that we look after our own mental health and well-being. So what tips have you got for us of what we can do to prevent burnout?
It's a really important point, Julie, because I think often we don't think about looking after ourselves. We perhaps look after other people before us. So I think, it's really those basic things that we need to be thinking about. So making sleep a priority. So sleep has an enormous impact in terms of how we function and how we can manage stress. Things like taking regular exercise, releasing those feel-good endorphins. Things like keeping regularly hydrated and eating properly, and all those kind of things that can really impact and help us cope with those kind of challenges and those stresses that come to us. But I think it's also important that as individuals we do reach out for help and support as well. Like I said before, it might be that you get to a point where you need to get medical help and you go to a GP, but actually asking your manager for support, asking, making use of the support services that you have at work. So it might be something like an employee assistance program, it might be a colleague, it might be a mental health first aider, but really important that we do that, and we do look after ourselves.
That's fantastic, Francoise. And I think, I've definitely got some tips to take away about actually think about my own mental health and well-being, making sure I'm getting some exercise, although that might not always be easy as we're coming into the winter months, and also taking advantage of what support is there within the organisation. So thanks for that. And it's been brilliant talking to you today. So great to catch up.
Great to speak to you, Julie. Take care.
Bye.